All right, thank you so much. Hi, everyone. Thank you for spending your time today with me, and we are going to be revisiting separation anxiety, but we're going to be taking a slightly different look at it. So I guess I will leave my camera on if that's okay with everyone. I guess I don't have to, but you can see that there is actually someone on the other end talking with you. So, and as always, first I'd like to thank Assisi Animal Health for putting on these educational webinars for different parts of our profession and for clients. It's a lot for them to do, but they believe in its importance, and I believe in the importance of all of us educating each other. So thank you to Assisi Animal Health for putting these on and for the honor of asking me to present. So yay! So let's talk again a little bit about separation anxiety in dogs. We know that dogs are social animals, and by nature, they prefer the company of people or even other animals to solitude. Even those dogs that appear independent, right? They don't need to be right next to you. They might even be napping in a distant bedroom, but they base that independence on the fact that they know their owners aren't very far away. As many of us know, there's a world of difference between dogs who wander to a quiet spot in the house and those who are left alone for hours as owners go to work, run errands, or participate in social activities. And for the past year and a half, we as pet owners haven't been able to do a lot of those. We've been working from home, or their siblings, the human siblings, have been attending school online. So now with the world starting to try to get back to the new normal, we are going to see more separation anxiety. And separation anxiety truly is a disease condition. It's the clinical diagnosis that's applied to a whole variety of behavioral issues that have one thing in common: that the dog is left behind, if you will, by its human. And we know that it can present in a number of different ways with a whole range of intensities. So if I were to ask you guys, because I know that you work in shelters, and thank you for all that you do. If I were to ask you, what are some signs? You guys probably know better than anybody. We know that signs of separation anxiety or dogs that are exhibiting their distress, that manifests by destructive chewing, right? Digging, typically at windows, doors, other exit points. They might urinate or defecate in the house, typically shortly after the owner leaves. They're vocalizing. Cats will do that as well. Licking that causes fur loss or raw skin. And for those who are, treat focused, sometimes they may refuse treats or be more rough when they're taking treats. You know these as well as I do: pacing, panting, even if it's not hot, and then shaking. Sometimes, like you see this beagle here, shaking like they're wet, but they haven't been in water. So, and you can see this guy on the bottom. I mean, his ears are down, the back a little bit. He's anxious, right? So dogs and cats are also able to pick up on human behaviors and stressors. So as everyone is starting to get back to either going to work or a new routine, or maybe going back to school, our dogs and our cats can pick up on those behaviors, and especially our stressors. So not only is the dog anxious, but they can pick up on our anxiety. So when pet owners are struggling, pets may be affected too. a lot of pet owners are experiencing dramatic increases in their own anxiety and depression, and have been really for the past 16, 18 months. All of these things also impact pet health and pet happiness. So we know that some owners think that the destructive behavior from separation anxiety is purposefully directed toward them because the pet is retaliating about being left alone or confined. But we know that's not the case. Part of the reason, though, for that is due to the fact that the objects that are commonly damaged include personal items belonging to the owner. So as you can see in this picture, shoes, books, clothing, sofa cushions where the owner has been sitting. But it's not so much retaliation. What these objects have in common is that they are frequently handled by the owner and carry the owner's scent. So therefore, contact with these items may serve to remind the pet of the absent owner, which then causes anxiety that triggers that destructive displacement behavior. So as we've mentioned a couple of times, I think we all, the US and I think the world is hoping that the pandemic end is getting closer. Changes in a pet owner's routine, kind of like, preparing to go back to work after the pandemic, can trigger separation anxiety in pets. And the dogs or cats that may not have had separation anxiety or distress, they can start to develop it. And certainly it can exacerbate separation anxiety in the ones that don't already have it. So how are we going to help pet owners? Or if owners are coming in to surrender a dog or a cat, I know that all of you are working hard to keep that pet in their home. So there's a simplified program that deals with proper homecoming and departures and teaching that relaxed independence for the dog when they're away from owners. So what we want to do is start, discussing decoupling departure cues from actual departures. And that, in combination with medications and drug therapy from veterinarians, may serve to improve most of the problems. And also, as you know, targeted pulsed electromagnetic field therapy, Calmer Canine, is another part of this multimodal approach to help manage separation anxiety. So we want to create a safe haven, right? If the dog is barrier anxious and digging, chewing, or scratching its way through distress, then we need to identify or help the owner identify a dog-proof area, such as the kitchen, the mudroom, or maybe even a spare bedroom. This safe haven should be a space where the dog, on its own, chooses to sleep at times. And what we want to do is have the owner invest in a tall, securely bolted, and easily opened gate for the safe haven, because many dogs panic when faced with a solid door that is closed. And again, our veterinarians are going to help with this part, right? Dogs with separation anxiety, we know they're stressed and they're oftentimes traumatized with an impaired ability to learn new tasks. So behavior modification can be effective in treatment. Anxiolytic drug therapy can also facilitate treatment and, in many cases, in combination, reduce anxiety more than training or management changes alone. So again, it's that multimodal approach that I mentioned. Medication or drug therapy is commonly used to assist with behavior modification. It's both humane and helpful. So we want to encourage our owners to track progress with journals and videotapes. You know, we really want to get a baseline for the behavior that the pet is exhibiting, panting, pacing, maybe urinating or defecating, as well as their timing and intensity. All of that is needed to determine whether a treatment or a multimodal approach is working. So typically a video camera can be aimed at areas where elimination or that destructive behavior has occurred. And really the recording only has to be anywhere from half an hour to an hour. And because that's going to give the veterinary team a reasonable idea of the dog's distress immediately after the owner leaves. And if barking is the primary complaint, then audio taping oftentimes is enough. And we need to talk to the owner and remind them that video and audio taping is going to need to be repeated as needed to help the veterinary team and the shelter team, because we're working in conjunction here, to monitor progress. Journaling, a lot of people like to do journaling, and really a journal of the dog's behavior is also helpful and should include like elimination behavior when they actually eliminate outdoors, as well as when the owner leaves the house and returns. All of this information is going to help the team as a whole manage the separation anxiety as, you know, as parents and children and adult children go back to either school or work. We also want to discuss hyperattachment. So dogs that can't adapt to being separated when the owners are home may be less likely to tolerate when the owner's actually leaving. So this is what we are terming hyperattachment. So to encourage independence from the owner, we want to provide a mat or maybe an open crate like you see here, a mat in a crate, but the crate is not locked. Or again, the safe haven room could be an alternative, where attention is offered when the dog is calmly sitting or lying down in that area. And that area can then eventually be used when the owner actually leaves. And to facilitate, you know, hyperattachment and the process of getting breaking, shouldn't say breaking, but maybe bending that hyperattachment, we want to encourage food dispensing toys, such as a Kong toy or, you know, a number of the ones that you see on the screen here. And so anxious dogs may benefit when fed a food from a food dispensing toy rather than their own bowl, because this type of interactive food toy is distracting and counter conditions the pet. So in other words, it's redirecting the dog's attention to something pleasant during an unpleasant time. And they should be also offered at other times as well to keep their presence from becoming associated. We don't want to cause, you know, another bad association or negative association between this toy and the owner leaving. So again, we talked a little bit about habituating to cues of departure. And so desensitization can be helpful for dogs that become reactive at the moment that the owner is leaving. So we need to think about when owners are walking to the door, they're opening it, or even walking out. And so again, in conjunction with the entire team, so the veterinarian is going to prescribe an anxiolytic for at least a month. And, you know, they've learned to manipulate their food dispensing toys in their safe havens. This is about the time where we are working with the owners to begin desensitization. And the technique introduces repeated exposure or habituation to those departure clues. such as picking up the keys, turning off the lights, donning a coat. And remember, we're talking about a multimodal approach. So we have our medications, food dispensing toys, our safe havens, and our targeted pulse electromagnetic field therapy. So we can start desensitization when with repeated exposure. So they're becoming used to the departure cues. So the owner picks up their keys, or maybe they go to the door and they turn off the light, or maybe they're, you know, not obviously in the summer, but you know, maybe they're putting on a coat. These are cues to begin the desensitization, because what we're trying to do is help dogs dissociate these cues from actual departures. And once we get them, you know, habituated, then we need to change it up a little bit, change the ritual, because what we're trying to do is, in addition to helping the dog dissociate these departure cues from actual departures, we also want to change them up because, again, we want to help desensitize these dogs and cats, but right now we're talking dogs, to the departure cues. So maybe we could have the owner leave through a different door, or park down the street, or put the coat on in the garage, just trying to get them to change things up a little bit. So once the dog has responded well to the simulated departures and changes in the departure cues that we just talked about, then we can begin working on desensitizing to actual true departures. So to begin with, departure should be brief and the owner shouldn't actually leave. The door can be approached, touched, even opened slightly, and then closed. The duration of departure should be determined by videotape. So let me give you an example. If the owner leaves for 5 minutes, but the videotape shows the dog calm for only about 3 minutes, then 5 minutes is too long and the time should be shortened. Depending on the dog's tolerance, the first actual departure may last from a few seconds to a few minutes. The length of each subsequent departure should be gradually but randomly increased by a few minutes, because remember, cognitively, dogs are very smart. They will pick up on and understand, you know, if everything is the same time consistently, they'll be expecting that. So during this desensitization, we have to change things up. Okay, so then we need, sorry, that was my fan that just fell on the floor, so I apologize for that. So it's important also to recognize that breaks in the dog's calm behavior will happen. Rising, approaching the door anxiously, vocalizing, and or acting nervous indicate the desensitization session has moved along too fast. So we have to end the session after a few successful but shorter departures. What we want to do is make sure that we are ending on a success. And then in follow-up sessions, the dog should participate in less challenging exercises, again, that it can successfully tolerate. We're not trying to make this harder on the pets, right? We're trying to make it easier. We want to enhance success. So also with, you know, with the pandemic and everyone being home for so long, I think there's been a lot of changes as to how people live in their house with their pets. And so we want to help minimize the difference between owner's presence and absence. So we really don't want to change the noise level. So if they're used to having the television on all day because, the kids have been home or whatever, then let's leave the television on. The lights, if they've been on all day, maybe they should stay on, while we are training. And gates, again, if they're used to having gates up, then let's leave them up. White noise machines can help muffle sounds and provide background sound rather than silence. What we're trying to do is minimize owner-dog interactions when the owners are leaving or returning. And as I mentioned earlier, white noise machines are going to muffle outside noises and provide background sound rather than silence. So in addition to, or maybe even instead of like white noise or white noise machine, it has been shown that dogs like classical music, so we could leave that on, or even talk radio. So if they like having, someone talking, then we could do that, or leave the TV on. And again, we want to remind owners to avoid punishment. We don't want them to punish the dog for anxiety-related behaviors because by definition, punishment, right, is unpleasant or aversive. So whether the dog is chewing, digging, inappropriately eliminating, barking, etc., all such behaviors are manifestations of distress. If the owner's arrival home is associated with punishment, or the owner suddenly opens the door to shout at or discipline the dog, their anxiety can worsen. So the guilty look described by many owners indicates that classical conditioning has occurred. The dog now associates the presence of urine, feces, or destroyed items with the owner's arrival and punishment. So typically the behavior will occur the next time the owner leaves. So reprimanding the dog for bad behavior hours after the behavior takes place does nothing to prevent the behavior from recurring in the future. And that's really important for us to educate our pet owners about. Environmental enrichment is a huge part of helping pets through social anxiety, right? Pets thrive with play, exercise, and mental stimulation. When those needs are not met, dogs and cats may act out or experience separation anxiety. So one of the main things that we want to do to try to prevent anxiety in pets and other behavioral issues would be to try to make sure the home environment meets the needs of the pets. So it has been shown that when pets have enough engagement at home, they're going to be happier overall. So pets that get plenty of exercise and entertainment use up their energy in positive ways. And they use up their energy in healthy ways as well before the owner leaves. It's a bored pet that is more likely to seek out extra attention with unwanted behaviors. And you've heard me say it before, you'll hear me say it again, exercise is so important. Frequent exercise sessions have a calming effect. It helps to decrease anxiety and provide suitable social interaction. So vigorous aerobic activity 2 to 3 times daily can have a very positive effect. And you know what? It doesn't even have to be vigorous. It doesn't have to be truly aerobic. Let's just encourage our owners to get out, maybe play, in the backyard with their dog or take them for a walk. When those needs aren't met, again, dogs and cats may act out or experience separation anxiety. Exercise also helps to release those feel-good hormones, serotonin, dopamine, and endorphins. So we need to provide suitable social interaction. And as I said, 2 to 3 times a day would be great, but even 2 to 3 times a week is going to be wonderful. And then Calmer Canine, which I know, everyone knows a great deal about, but I do want to tell you that it's a highly innovative, gentle, effective, safe, and drug-free treatment specifically for canine separation anxiety. And the Calmer Canine delivers targeted pulsed electromagnetic field therapy, as I've mentioned throughout our half hour. And it signals the area of the brain responsible for causing the symptoms of anxiety that we've just been talking about. And it effectively returns the anxious brain to a more balanced emotional state with long-lasting effects. And it is one tool in our arsenal, in our multimodal approach. And it is a wonderful tool. I think many of you out there would agree with me that it has been proven to work alone without other treatments or in conjunction as part of a multimodal approach. And it's safe to use with other solutions for anxiety, such as medications. And so we know that as the fight or flight center, the amygdala is the area in the brain responsible for producing fear and emotional responses, which express themselves as the signs and symptoms of anxiety, the signs and symptoms that we've been talking about. An anxious brain is out of balance. The overactive brain cells are producing harmful substances, causing inflammation and cell death, instead of beneficial substances that reduce inflammation and protect the cells. So this is why I love Calmer Canine, because it works at the cellular level, sending targeted pulsed electromagnetic field signals to the brain to increase the production of nitric oxide that helps to reduce inflammation. The signals also cause the neural cells to produce those feel-good substances again that I mentioned earlier: serotonin, dopamine, and endorphins. So the system includes a comfortable, easy-to-use vest that holds the device in the proper position over the dog's head during treatments. And it's typically 2 15-minute treatments a day for 4 to 6 weeks. And that has been shown to significantly reduce signs of separation anxiety, including the signs that we talked about: barking, whining, destruction, panting, pacing, house soiling, with lasting effects. So it significantly reduces the signs of separation anxiety. It improves the pet's quality of life. And I think that's why many of us are in the field that we're in. We want to allow and we want to improve the pet's quality of life. It increases the time the dog spends playing, grooming, and resting when home alone. And results have been shown to last after therapy has been discontinued in most of the dogs. It also can help with other anxieties. Think of noise phobia, thunder phobias, travel anxiety, stranger anxiety. The treatment is very well tolerated, providing a gentle, it's very gentle and it's sensation-free. And again, I know I've mentioned it, but it's effective as a standalone therapy or in a multimodal approach. So when we're talking to pet owners, some time should always be spent discussing similar situations in the future that might trigger a recurrence and how to best avoid problems. So when the owner anticipates a significant alteration in schedule or in the amount of time that might be spent alone, the changeover should be made as slowly as possible. What we're trying to do is rebuild that human-animal bond. Remember, dogs are social animals. They prefer the company of people and animals. And separation anxiety is a true diagnosis. It's a variety of behavior issues based on the dog being left behind from its human. So it does take a great deal of patience. But again, if we can rebuild that human-animal bond, that's a wonderful thing. And you won't be seeing quite as many dogs relinquished to you because of separation anxiety. That's the goal right there, right? Just hanging out. So again, separation anxiety in dogs, there's a multimodal approach to managing it. Desensitization, medication, calmer canine, food dispensing toys, safe havens, and above all, patience. So thank you very much.